Sounds good. Okay, welcome again. Continuing about IV therapy, very important, very important. I'd like to do a little bit about the insertion of the needle and the sterility that's necessary. I don't think I told you, and anytime people draw blood, okay, let's go a little broader than just IV. All of us go to a lab and have our blood drawn. That's common, and you're with a professional. Very good about doing generally. But I got to tell you one story because it illustrates what I mean. Maybe you remember this, Joe. I went to one of the labs to have my blood drawn. And there was two young women there, lab technicians, I assume. And they were talking about their date the night before. And they were both comparing notes, and they were talking about one particular guy. I don't know, it was on and on. I was just listening to it. And I noticed that the lab technician, as she got the needle and everything, the needle hit her sweater. And I thought, wait a minute. I mean, I'm listening to their story, but she wasn't concentrating on what she was doing. So I wasn't going to sit there and let her inject my arm with a contaminated needle. So I said something. I said, I probably said, hey, honey, look, you just hit the needle on your sweater. I don't know what else to say. Oh, no. And some mumble. She put a new needle on and proceeded. That, to me, illustrates you watch. Not to look for errors, because these are professionals. This was maybe an isolated incident, but remember they're human beings. They have lives. They date. They might have been out all night at a party. It could be anything that is distracting at that moment of time, so that you stay focused. Your body, your vein, you don't want to get an infection. So this sterility of putting in the IV is very important. The care that's taken, wiping the alcohol on the area and setting it in. The placement, I said, is very important. And once it's in, you got to make sure as a nurse that it's in the vein. Particularly with some solutions, they're very caustic to the vein. So they're very conscious of that and giving chemotherapy and like that. It's got to be placed correctly in the vein. If it gets out, it could damage the tissue. So you want to be sure. And the nurse is what she's supposed to do, make sure. And please excuse me, I know there's a million good male nurses now, thank goodness, but this he, she thing, so I'm going to refer to nurse as she. Okay, just follow me on this. So she needs to double check that. Now what's hung up there? You ever curious about what is in the IV bag? You should be. Is something going in your body? And it's a simple question. What's hanging there now? Is it dextrose and water? Is it a different concentration of normal saline? When I was there, surgeons used to like Ringer's solution. Electrolytes in it. I don't know. They might not use it anymore. IVs. What IV is in the which bag goes first? Just a question. It's not a heavy-duty question, but it's one of the things you should know, and you might want to jot that down, so you know what IVs you're getting and how many. Because the doctor will order. Back me up. How many cc's in 24 hours, right?
I wouldn't know.
Okay, well, whatever. I know that's usually the order, so many 1,000 cc's in 24 hours, or whatever the order is. It's very specific. So the thing they do is that you stagger these IVs so they cover the 24 hours. And you make sure that they're going in at the proper rate, the proper drip rate. We used to have to look at our watch and count the drips and calculate how much. Now there's machines that do that. But you still got to monitor machines because they beep and they're not working, and they're kind of more irritating than they're helpful. But it's actually that the drip has to go in at a certain amount. Not too fast, not too slow. Fast enough to keep the vein open, but not too fast. And the nurse cannot go and say they're behind a little bit on the amount of cc's that get in 24 hours. You can't speed that IV up to get it in fast, okay? Believe it or not, that could be done. And it's particularly harmful to elderly patients or anyone who has a heart condition. It's a steady rate, it's calculated, and it goes at that rate. And you can count the rate, you can ask, how many drops per minute is it going in? So that you know, as you look at it, you can count it now and then, just to make sure that it's going at the proper rate. That's a part of, it's a simple question, but it's very important. In pediatric units, they have a calibrated, like 10 cc. The solution goes into a smaller, because babies, they can't take too much. They know that. They give it very carefully because the circulatory system is small. It's logical. It makes sense. So you know. The other thing you want to know is how often do they check change the tubing? What is the protocol? What does the hospital say? Do they use the same? Do they change it every 24 hours? You know, start with new, fresh. Seems logical, but I don't know. Maybe they check it in each shift, puts up new tubing, flushes the tubing, puts up new tubing. I don't know what they are, but that's a question I'd want to know if Joe was in the hospital or I was in the hospital. I want to know when they check the tubing and how often. Seems like an important thing. Now, one of them, I think we'll go into blood transfusions now because that's very commonly given. Blood transfusions have got to be type and cross-match. Everybody knows that. If you're A positive, you can't get B negative. What happens is your system can't take that. Blood transfusions are extremely precise with a lot of factors in them. So when nurses hang blood, basically, or the lab hangs blood, there has to be two people checking. Okay, this has been always standard procedure. The nurse who receives the blood checks the patient and what their blood type is. Then there's a second nurse who checks it again. It's called a type of redundancy, and it's absolutely necessary. And it's not unusual. You, as the family member, can say, I know my husband is A positive. Is that A positive blood? I mean, you know, it's a simple question. You're not doubting their ability to do it, but what you're doing is doing a third check because the blood, and also a person receiving blood should be checked very quickly after it's started, within 15 minutes, to make sure there's no untoward reaction. There should have, at least I was taught, that there should be some normal saline, a certain type of, hung at the same time, so that if there is some sort of reaction, the blood can be stopped and the normal saline could be put in to keep the system open. They're built into the procedure. They may vary from hospital to hospital, but it's the kind of care that needs to be done. And it's also a question to the doctor, you know, how much, in the emergency room, they're giving blood all the time and they have their system down. But it doesn't hurt to just ask a simple question about blood type. It's that third level of care that goes into it. Joe, question, any observations about that, or
no?
Anything you would want if you were getting blood in the hospital, or?
Well, I just want to make sure it's the right kind of blood.
Yeah, type and cross-matched and all
yes, but they do have to check, you know, two things really.
At least two times. So remember that when you go in the hospital, because that's a standard of care.
But I don't know if they have two nurses that'll check.
Well, it could be a
Two
licensed practical nurse, a PA,
yes.
two people, I think. Again, it depends on what the hospital protocol is. Mm-hmm. And that's something you could find out or ask. Intravenous therapy, I put a lot of questions here. Say someone keeps on sticking you, you know, with you're going in to get your blood drawn. They have trouble finding the vein. Happened to you?
Every time.
So, you know, you have a right to say after 2 sticks, or maybe 3, is there someone else that may be able to get in? I mean, that's your body, that's your vein. that's, something is wrong. They put the, the tourniquet on it, and you're doing this, and they try to go in. Some people have veins that are easier to get into. They do this kind of hitting of it. But how many times did you have for the IV?
Almost every time I've ever
How many? Every time you go?
Yeah, because I don't have really great veins and they always go for like the eyes of your elbows. I've had people have more success with my hands, but I think people don't do that because it hurts more. But I to this day, I now go in and I'm like, I want the
maybe
wisest.
not as stable, smaller veins, but it might be something you would want to say to them as you go in. Look, if people have a lot of trouble with my veins, is there another vein that we can go in that might be a little easier?
Or ask for the most. I usually ask for the most experienced person there. I'm like, hey, like people usually have a really hard time with this. Please don't give me the newbie. You know what I mean? Like the newest, the youngest, newest person. So I have
ask
done
for
that.
someone who's experienced. Is this in a lab or in
a lab? Yes, or like urgent care.
Yeah, they're the pros actually in the lab, but that doesn't mean they all have the same amount of skill.
Yeah. Or but like you can ask for the smaller needle too, I think.
Yeah, I didn't mention gauge of needle, which is very important. Like with blood, they lose, let's think of the gauge of the needle, a little opening in the needle that it's going through. A larger gauge has no, this is backwards because I always had trouble with this. A higher gauge is a smaller needle. Now that doesn't make sense to me, I think logically, but that's the way it goes. So an 18 gauge is a tiny little gauge.
A 2 is like a
it's
tube.
bigger. And they need a bigger gauge for blood because blood is thicker, okay? But the gauge of the needle does affect, how much it hurts going in. So you could check on what gauge needle. Saline and those sort of solutions are very, normal saline is very thin and drawing the blood back. They might have to have they probably do have to have a certain gauge to draw blood back out. So that might determine the gauge of what's being stuck in your arm. But that's very important that you know that. I get nervous with needles. I know you're trying, but I need someone to get in right away. That's an iMessage. It's not saying you're a terrible blood drawer. It's just saying, geez, I really am nervous about this. I don't like needles. How many liters of fluid have been ordered, and how does that translate into drops per minute? Fairly simple question, not too. If the IV stops flowing, what will you do to get it started again? Should I watch the IV carefully and ring the buzzer when it gets down to the very bottom? The nurse should be checking that anyway, all the time, but you never know. What should I look for in the IV zone? Now remember, you're often going home. You might have IVs at home. Maybe the nurse, the home nurse would be giving the IVs. It's possible. All these treatments that used to be just hospital are now going to the home. So you need to know what signs you would have on this area that are saying infiltration, infiltration or infection. And obviously, any redness in the site is a red flag right away. Okay. Looks really red around. The nurse should be checking that. That's a given. But remember that if you're ever getting anything at home, any IV fluid. How often do you change the IV fluid? My question. Talk about the IVs. I understand my blood type is A positive. I also like to check the bag for my name and blood type. I understand, you're the patient, you're needing blood, you can't say that, but your family member can say that. Okay, I like to check the bag too. Okay, questions about intravenous, very important. Setting it up, monitoring it, taking it out. They usually put compression on it, put a little tightness. Some people bleed more from the IV site than others. Sterile, everything sterile. Anything with the blood sterile. I can't say that enough. So if you see any violations in procedure, you call them on that. I think I'm done with IVs. Joe, Courtney, anything? Okay. We'll stop here, and then I promise, the next time I'm getting this equipment so I can handle it here and you can see it all. Okay, and please, if you have any friends or any relatives that are facing a hospitalization, I hope I'm helping some people, but it's important that I meet a lot of people and help a lot of people. My thing is, and I'm sure this is delusions of grandeur, but I like that to be the norm. That all patients and families ask good questions based on knowledge, and they know how to ask the questions. If it's a norm, then you won't be the oddball that comes into the hospital. It'll just be, of course, families and patients are going to ask questions about procedures because they're knowledgeable and they know how to ask them. So we spread the word a little bit. I don't know how I reach people through this YouTube thing, so I don't know. I'm dependent on you to share this with people you think might have some help with it. Okay, what am I under now? I'm under
Hospital Battlefield is now the name of your channel.
And how to
and the
survive.
videos are like how to whatever you're speaking of that day. They're all labeled that way.
Okay, we're in the how to now, right?
Yep.
Okay, that's what my granddaughter said. All right, thank you. We'll see you next week.